Hi everyone, this is Dr. Joseph Hammer, and I'm bringing you a video update on some of the interesting things I've found by analyzing the results of people like you on the Mental Health Professions Career Test. So, as you may know from having done the survey yourself, you click whether you are interested in or not interested in a variety of different work tasks. Doing that gives you scores from 0 to 100 on 21 different mental health professions, and they're the ones listed here. After receiving those results, people then have the opportunity to let me know via this question on the survey which of these occupations would be of particular interest to them. And so you can select one or many of these things. And I thought it would be interesting to look at the pattern of how people indicated likes or dislikes on these 21 different things. So if they clicked like on counseling psychologist, would they also be more likely than not to click like on certain other occupations, which allowed us to see how these occupations cluster together in terms of if a given type of person likes this occupation, they tend to like this second and third one as well. And so I performed a factor analysis to check that out. And this is what I found using a sample of 632 individuals who took the test. There are different ways that the occupations cluster together. Looking at a scree plot of the results, which you don't have to worry about what that is if you're not into stats. But looking at the scree plot, a very quick and dirty analysis suggests that there's 1, 2, 3, 4 factors before the elbow here. And so when we look at the 4-factor solution, we get this. So in plain English, we see that these 5 occupations, which are all specialties of psychology, all of those cluster together. So what that means is that if you said, yeah, I'm interested in clinical psych, you were more likely than not to say, yeah, I'm interested in counseling, school, neuro, industrial. Not to the same degree as clinical psych, but you're more likely to say, yes, I like these too. So these all cluster together. But being more likely on clinical psychologist doesn't necessarily mean you're more likely on these ones or these ones or these ones. Other clusters that we saw besides the psychologist cluster is this master's degree level talk therapy focused cluster. So these folks here tend to use talk therapy and discussion with clients to help them with their health needs and their mental health needs in particular. So these all clustered together. If you were interested in some of these, you tended to be more interested in some of these others compared to all the other stuff. And then our third cluster was we got the vocational and career counselors who do some guidance, and then we've got social and human service assistants and social and community service managers. So it's sort of a master's level social service cluster. And then the psychiatric aides and technicians partied on this cluster as well to some degree. So these were more all likely to be indicated by a given person. And then we've got here a sort of psychiatric cluster, advanced practice psychiatric nurses, and then psychiatrists, which is a type of medical physician. And then arbitrators, mediators, and conciliators tried to party with them a little bit as well. They kind of clustered on the same thing, but they were somewhat of an odd duck. Now, I have only shown the loadings greater than 0.30 on this in the factor analysis, so there's some more complicated stuff under the hood. But some of the stuff that did get retained, you can see that sometimes a given occupation had loadings on more than one factor. So for example, psychiatrists loaded 0.30 on along with the psychologist folks, and then 0.40 on its own psychiatry thing. So that means that when folks indicated an interest in psychiatry, they were simultaneously interested in the other ones in this cluster, the advanced practice psychiatric nurses, but also they tended to have an affinity for the psychologist things. So that's kind of interesting. Likewise for psychiatric aides, they had a relation to both this cluster with the 0.35 and then this purple cluster as well. So people were kind of equally likely to hang out with this and hang out with this. And social and human service assistants, interestingly, not sure why, not only did they like to party with their fellow masters social service folks, but also tended to have an affinity for some of these psychologist things as well. And then rehab counselors, I should mention, not only hang out with the master's talk therapy stuff, but also because of that rehab aspect can get into some of the psychiatric and more medically stuff. So it's kind of an interesting statistical breakdown where we analyzed what people said they liked and clicked those boxes. So that's what these are. This is not the clustering of the official scores from the instrument. This is what people told me they liked and how those tended to cluster together. And we can also see the correlations among these four factors. So it ranges between -1 to 0 to +1. And so this is at 0.42. And so we can see this sort of moderate to strong relationship between the psychologist cluster and the master's talk therapy clusters. The psychologist cluster and master's in talk, they correlated at 0.42, slightly less between psych and the social services cluster, and then psych and psychiatric had a weaker relationship between these two clusters compared to psych with these other ones. And then you can see some of the other patterns, kind of the relationships growing smaller over time. So those are some interesting factor analysis results. So what that means is that if you were to take the test, look at your results, and then tell me what you thought was or was not interesting. If you tended to endorse something in this purple cluster, for example, you are then more likely to indicate some other things in this purple cluster compared to the psychologist cluster or the master's social service cluster or the psychiatric cluster. So that gives you hopefully a sense of some of the stuff I've found. Other things, I was also interested in figuring out how people's scores on the mental health professions career test ended up predicting or relating to what they told me on the feedback survey was of most interest to them. So specifically, did they click one of these things based on what they saw from their scores? And so this is the relationship between, these numbers quantify the relationship between a higher score on a given occupation and the likelihood of saying, yeah, I'm interested in that. So in theory, we should see this linear relationship such that as people got a higher and higher score on a given occupation, so an 80 out of 100 versus a 60 or a 40. So the higher that score is for an occupation, in theory, because it may be a good fit for their interests, we might expect, therefore, that people on the feedback survey would click that respective occupation. So for example, if someone scored an 80 on counseling psychologist, we would think that they'd be more likely than not to click yes for counseling psychologist, and maybe if they got an 85 on school psychologist, that they'd click yes on school psychologist. But if they got lower scores on some of the other ones like marriage and family therapy and healthcare social worker, maybe then we would not expect them to be as likely to click yes, I'm interested in these things. So we saw some interesting patterns in that not all occupations played by the same rules. So when someone got a higher score on counseling psychologist, they were more likely than not to also indicate, yes, I'm interested in counseling psychology as an occupation. Similar degree, so that's at a 0.46, so a moderate to strong relation. Similar deal for clinical psychologists, starting to dip for school psychologists and neuropsychologists, in the 30s for industrial, dipping down for marriage and family, big dip down for healthcare and social workers. So you can kind of see the pattern of results for each of these. Oops, sorry about that. For each of these occupations. And what that means is that, so for example, what does a lower score mean with the symbol with less black filled in with it? It means that when someone's score was higher on child, family, and school social workers, that did not necessarily mean they were going to click, yes, I'm interested in this occupation. Someone asked at this point, which of the 21 mental health occupations are of interest to you, didn't necessarily mean they were likely to check interest in that. Now, there could be 1,000 different reasons why this statistical effect is the way it is. And we don't know because we didn't collect that data to explain the relationship. But it's just kind of, it gets me interested and fascinated by why things might be related in the way that they are. And it's also the case too, I should say, that not only does this quantify if you got a higher score for an occupation, are you more likely to click like, but it's also simultaneously quantifies the reverse. So if you got a lower score on an occupation, it quantifies the degree to which you might not have unchecked it. Or to be more clear with that, for something like, say, a psychiatrist, which didn't have too low of a score compared to some of these other ones. For a psychiatrist, because you can make a fair amount of money as a psychiatrist, I wouldn't be surprised to see that even though people were getting, perhaps some people might get low scores on psychiatrists, which you think would mean they won't check the box because they don't perceive it being a good fit, that they might still check the box as being interesting to them, even if it's not within their interests, because even though it's not maybe interesting, maybe they can make a lot of money, or it's in line with their values and family expectations or whatever else. So it works that way too. This number incorporates both. But you can kind of see some patterns of what occupations their interest scores don't relate to what they like to pursue, and which are not the case. And interesting, vocational and career counselors, their interest ratings, their interest score was one of the better predictors of whether they were interested or not, whether they indicated interest through the checkbox or not. So yeah, I'm just still wrapping my head around what this means, but it's just interesting that there's some greater or lesser correspondence between interest scores and what people tell me post hoc that they're interested in. And by the way, if we scroll up here, I showed you that factor analysis earlier. We can see on an occupation by occupation basis how people's like, so when they check the boxes for the 21 different occupations, if they check a box for counseling psychologist, how likely are they to check the box for a variety of other occupations, for example. So if you check counseling psychologist, let's see, 0.63, this is the highest one. So your counseling psychologist check mark means that statistically your folks are most likely to make their second check mark for mental health counselors. It tends to be reasonably predictive of also being interested in mental health counselors, which is interesting. Likewise, for clinical and counseling psychologists, and by the way, the numbers below the diagonal are the same as above the diagonal. That's what happens with the correlation table. We see also that counseling psychologists and clinical psychologists, those indicating like, tend to be quite similar compared to some of the other predictive relationships. In contrast, if you look on the lower end, if you say, yeah, I like counseling psychologist, that tends to have absolutely no relationship with whether you might also indicate interest in advanced practice psychiatric nurses. It doesn't mean you're purposely likely to uncheck it. It just means that there's no demonstrable relationship. So the relationship between counseling psychologists and advanced practice psychiatric nurses, it was random, basically. You could never guess based on whether they clicked one of these if they would also click the other. And interestingly, we don't see any negatives. These are really weak effects. So we don't see any bigger numbers into like the 0.2s, 0.3s, and above that are negatives, meaning if you indicate interest in one of these, then you're actually less likely to indicate interest in something else. So like this 0.06 is a pretty weak effect. but technically, if you indicated neuropsychologist, you were less likely to do educational and vice versa. And let's scroll over here a bit to make sure that's the case. Yeah, so we're not really seeing anything more than about a negative 0.06 on anything. So yeah, it was either indicating something meant you're more likely to indicate something else, or there was randomness, no relationship. So you can kind of get a sense here of what stuff related to what stuff. Let's see what else. So counseling psychologists with clinical and mental health counselors were pretty predictive. Clinical, kind of the same pattern, although clinical folks were more likely to endorse also psychiatry compared to counseling psychologists also endorsing psychiatry. This is kind of interesting. School psychologists and educational and school counselors tended to be related. People tend to like one and thus the other, and that makes sense because they're both school-centric. Neuro had a lot of unrelations with other types of things. So neuropsychologists kind of being more in the neurons and the brain chemistry. It makes sense that it's one of the higher scores is with psychiatrists because they're also looking at some of that brain biological behavior aspect. Industrial organizational psychologists and vocational and career counselors, some of the biggest effect, which makes sense since they both can deal with career and workplace stuff. Marriage and family therapists with counseling psych and some degree school, and mental health counselors and a little bit child family school. Social workers, marriage and family, family and family, that makes sense, right? That there would be a relation there. Healthcare social workers, no huge effects. It's kind of the closest with social and human service agencies. And by the way, this pattern of correlations is why we saw the factor results that we did earlier. That's what shapes how the pattern is going to come out. Mental health and substance abuse social workers were also likely to say interest in mental health counselors and substance abuse and behavioral disorder counselors. That makes sense. They oftentimes are all using that master's level mental health degree and licensure as a counselor, as a licensed professional clinical counselor. I need to freeze that pane so that we can scoot our thing over. Let's see if we can do that. Freeze panes, freeze first column. Let's see if that works. Oh, good. Okay, we can look at the rest now. Okay. Where do we leave off? I think we have mental health counselors has a lot of overlap with a bunch of things. That's interesting. If you tend to be interested in this, you can be interested in a wide variety of other things. Rehab, the most with substance abuse and behavioral disorders, and mental health, yeah. Substance abuse, yeah. So we started to repeat some of these results because they're the same above and below the diagonal. So let's see, is there anything else that stands out to me? No, I think we covered it all. So yeah, so these are some of the interesting things I've been finding with the data that you all have provided to me, and thank you for that. Once I get more longitudinal data, I'll start to look at whether your responses earlier predict what stuff you end up choosing and are interested in several years later, what kind of graduate programs you might go into. That's the sort of data that I'd be really interested in getting in the future once it becomes available. But these are some preliminary results that I thought were pretty neat to see how people have been approaching these mental health professions. And so I hope this context was interesting, and welcome your questions and comments. And if this was worth your time, consider liking and subscribing. And please check out Dr. Joseph Hammer for a variety of resources for students if you haven't already. Thanks a lot.